nutritional anemia. Those who have the old textbook, it's page number 207, 207. Those who have the new textbook, it's 255. So nutritional anemia is caused by lack of iron, proteins, vitamin B2, B12, and other vitamins and minerals that is needed for the formation of hemoglobin. Okay. The formation of hemoglobin is very complex. From the name itself, hemoglobin. Protein is there. So if globin is a protein, okay. So if you are deficient in protein, hemoglobin production will be reduced. Okay. And if you're deficient in iron, vitamin B12, copper, okay, other vitamins, okay, mineral in copper is required for our red blood cell formation. Okay, so if these things are deficient, even if you are if the body has sufficient amount of iron, but it lacks B12, it lacks copper, okay, in that case also it will reduce the amount of healthy red blood cells that are produced. Okay, so nutritional anemia, to correct it, it's very complex. Okay, it will not develop overnight. You won't turn anemic overnight until and unless you have undergone severe blood loss because of accidents, trauma. Okay, hemorrhages have happened, internal bleeding, external bleeding has happened. You have lost a lot of blood within 24 or 48 hours. Only then immediately you can turn anemic. But apart from that, nutritionally speaking, you will not turn anemic within a day. It takes around 6 months or 9 months for anemia to develop. Okay. So anemia, in simple terms, it's a lack of healthy functioning red blood cells. Okay, nutritional anemia. And there are different forms of anemia as well. We'll discuss that in Wednesday classes. So prevalence of anemia, 30% of the entire world population is already anemic. Who are at risk? Young children and pregnant women are at higher risk of turning anemic. And in India, 60% of Indian population is anemic. Mild, moderate, severe. There are different categories of anemia and different types of anemia. Okay. So including all that, 60% of Indian population is anemic, and majority of the anemia here in India is nutritional anemia, iron deficiency anemia, folic acid deficiency anemia. These are the two major forms of anemia we see in India. Okay. Over half of the Indian women, specifically in reproductive age group, suffer from anemia. Okay, that is the statistics in India. And 55% of them are in urban regions, 59% of them are in rural regions. More anemia you see in rural India among women and children. And majority of Indians suffer from iron deficiency anemia, and the incidence in pregnant women, even though free folic acid and free iron tablet supplements are given to pregnant women, but still we see 75 to 85% of pregnant women, they turn anemic. Okay. And anemia is severe and more in females as compared to males. Coming to the causes of anemia, in infants, okay, a big table is given in the textbook, table 11.1. Those who have the old textbook, in new textbook, we can mention the page number, causes of anemia. That table is important, okay, for your understanding, and even from exam point of view, causes of anemia in different age group is important. Okay, questions can come from here. So during infancy, if the mother is anemic, when the child is getting developed in the uterus, the child will be born with very less iron stores in the liver. Okay, because what do you think? Human breast milk, is it a good source of iron? Human breast milk, is it a good source of iron? No form of milk, not just human breast milk, no form of milk is a good source of iron. Okay. So when a woman is pregnant, okay, she has to focus on iron because it should be known that when the child is born, for the next 6 months, the child has no source of iron. Okay. Whatever the mother is going to have during her pregnancy, the child's liver is getting developed. The child's liver will store that iron that the mother has given to the child during her pregnancy. And okay, and these iron stores are supposed to support the child for the next 6 months until and unless exclusive breastfeeding ends. And when slowly you start weaning the child, weaning diet, you slowly start introducing um, other food apart from mother's breast milk. You have to focus more on iron rich and vitamins and mineral rich food, because the specific vitamins nutrients that are lacking in human breast milk, you have to focus more on that, and those kind of food has to be introduced. So till the first 6 months, the only thing that can support the child's iron requirements is the child's liver. Okay. And if the mother was anemic during her pregnancy, the child will be born anemic with low iron stores, okay, and lack of iron support throughout the exclusive breastfeeding stage. Okay. And specifically vegetarian mothers, okay, strict vegetarian mothers or vegan mothers during pregnancy, they have higher risk of giving birth to anemic newborns. Late weaning, not starting the weaning diet exactly at 6 months. Okay. Delaying the weaning period. Any absorption issues in the intestine of the child, if the child has some metabolic errors, okay, inborn metabolic errors, so some absorption issues will be there with regards to folate. Folate again is comes from mother's breast milk. If the mother is deficient in vitamin B complexes, the child will also become deficient. In childhood, again, dietary deficiency, not having enough iron rich food, vitamin B complex rich food, getting worm infestation, parasite infestation, tapeworm, hookworm. It is very common in children. Okay. Any inflammatory bowel diseases or any gastrointestinal diseases in children, neglect of female child, it's a sociological issue. Okay. Diet, even education and nutritional diet is focused more on male children rather than on female children. It's very common practice in some Indian households. Okay. Mostly in rural, in urban, things are changing. Then during adolescence, uh, in females, when the female child attains menarche is when her menstruation starts. Okay. So every month, females lose a lot of iron from their body because of bleeding. Okay. Growth spurt. The children during adolescence, they grow so fast. Okay. They quickly grow. And when the body is not able to keep up with that pace, automatically the child may turn anemic. Gender discrimination, again, the same. Neglect of female children or female teenagers. And some eating disorders, fad diets, crash diets, usually common among teenage girls, excessive blood loss during menstruation, and teenage pregnancies. Okay. In adults, again, pregnancy, no spacing between pregnancy, any infection, surgeries of the stomach or intestine, celiac disease, infestation of hookworm, tapeworm, not very rare, but it can still happen. Too much of tannins, oxalates in diet, too much of calcium in diet. Okay. Stress, drug induced anemia because of any immunosuppressive drugs that they are taking. During pregnancy, again, physiologically, the body's requirement increases. Tannins and oxalates, again, they are precipitates. They are insoluble, okay, in nature. Okay, that's the reason why you have to soak your legumes and pulses in water. When you soak the legumes and pulses in water, it removes oxalates and phytates from the legumes and pulses. You can drain out the water, wash the legumes and pulses thoroughly, and then cook them. Okay. In old textbook, it's on page number 2010. Sorry, 210. Any pregnancy-related complications can lead to anemia. Cultural beliefs and taboos of don't eat this when you're pregnant, don't eat that when you're pregnant. Okay, some nutritious food comes under the radar of taboo. Okay, so the woman loses their chance on healthy, nutritious diet. Low maternal age, that is teenage pregnancy, and multiple pregnancy, multipara means the mother, she has given birth to lot many children, okay? More than 3 children, 4 children, okay? That is multipara mothers. Then old age, definitely your absorption rate reduces in the intestine, loss of appetite. Even in diet, you don't focus more on iron-rich diet or folic acid diet. Gastritis, any disease conditions, medications that old senior citizens take that can also reduce the absorption of iron, loneliness, psychological issues, stresses of old age. Okay. Coming to the types of anemia. First is your hypochromatic microcytic anemia. So the red blood cells, RBCs, hypochromatic, from the name itself, you can understand it's not as bright red in color. Okay. This is normal RBC. You can see hypochromatic. It's not as bright red in color because of the lack of iron. Microcytic, you can see here. It may be good in color and all, but the size of the red blood cells is quite small as compared to normal cells. Microcytic. Okay. Again, because of iron deficiency, hemoglobin is not formed properly. That leads to hypochromic or microcytic anemia. Then we have megaloblastic anemia. In megaloblastic anemia, immature RBCs of big size, okay, big size, large size RBCs, but they are immature. Blast means immature cells, okay. So large but immature RBCs are released into the blood, okay. Proper maturation of RBCs is not happening in the bone marrow, okay. Immature but large size RBCs are released into the blood. That is megaloblastic anemia. Deficiencies of vitamin or impaired utilization of vitamins, these result in megaloblastic anemia. Usually because of the lack of folate or vitamin B12. Their sizes are different, bigger in size, larger than normal. Then we have dimorphic anemia. So again, this gives rise to hypochromic and macrocytic. Dimorphic means it is two types. You will get a blood sample in which some blood cells, some RBCs are hypochromic and other RBCs are macrocytic. Okay. But very less amount of normal RBC you will see. Okay. Some normal RBCs will be there, but majorly either some of them will be hypochromic, some will be macrocytic. That is dimorphic. Two types of blood cells you are seeing in the blood sample. Normal is definitely there, very less in number. Hypochromic and microcytic. Okay. And reason is same: iron deficiency, folate deficiency, B12 deficiency. Then we have the major iron deficiency anemia, which is the most common in India because of inadequate iron intake. Okay, not taking enough green vegetables, green leafy vegetables. Okay, too much of processed food. Okay, and not taking fortified. Nowadays, iron fortified salt, double fortified salt we call it. Double fortified salt means it is fortified in iodine and iron. That is double fortification. Okay, so double fortified salt is available. Iron fortified milk is available. Okay, uh, whatever regional milk brands you use. Okay, like Avin is available in Tamil Nadu. In Karnataka, Nandini milk is available. Okay, in Kerala it is Milma. New Delhi side it is Mother Dairy, Gujarat side it is Amul. Okay, so these milk production agencies, they are fortifying the milk as well with vitamin A, D, and iron. Okay, so if you don't use this packaged milk, milk is high in calcium, but to meet the major requirements, okay, some of the major requirements of the population, we are trying to fortify a lot of food which are used by all group of population. For example, salt, okay, wheat flour, oil, okay, these things, sunflower oil and all, these are used by majority of the Indian population, irrespective of the ethnicity. Okay, north, south, east, west, everyone uses salt, oil, flour, okay, etc. So these things, milk also, so these things undergo fortification so that with some addition of these nutrients, major part of the population's nutritional needs are met. Okay, and always remember, how much ever iron rich food you are having, out of it only 2 to 5% of iron, only that much is getting absorbed by your intestine. Okay, if you are having throughout the day, you are having 100 grams of iron. Okay, hardly 5 gram of it is getting absorbed. If you're having 27 grams of iron, which pregnant women should have, okay, 20, at least 27 gram of iron they should, they should have, sorry, 25 7 mg of iron, a pregnant woman should be having. Okay, out of which 1 gram or 2 gram is what uh, they absorb from the intestine. Then inadequate utilization of iron, even though the iron intake is normal, okay, but because of some issues in the stomach or intestine, gastrointestinal diseases, okay, or defective release of iron from the iron stores, liver is not releasing iron at the right time, okay, or the right kind of iron is not being released by the liver. These all are the internal issues, okay, because of which iron is not used properly. Even though the body has iron, iron stores are available, iron from the food is available, but you're not able to utilize it properly. Blood losses, we have discussed that. Too much of hemorrhage because of any accidents, or even when in menstruation, heavy bleeding, tuberculosis, ulcers, any intestinal disorders, cancers, bleeding cancers. Internally, you are losing a lot of blood. Any parasite infestation, okay, that could also lead to blood loss. Too much of blood donation as well. Okay, donating blood every 3 months, 4 months. That could also lead to blood losses, which leads to anemia. Postpartum hemorrhage, that is after pregnancy, bleeding happens, and if you are bleeding a lot after your labor or childbirth, okay, that is postpartum hemorrhage. That also leads to anemia, and usually it happens, postpartum hemorrhage risk happens in women who do not follow a proper spacing between children. Okay, less than 3 years of age gap between children, that leads to increased risk of postpartum hemorrhage. Then increased requirements, specifically when during infancy, during adolescence, during pregnancy, the body needs high requirements of iron. And if you are giving the bare minimum through your diet, okay, that will also put you into anemia. You are having, you are getting iron from diet, but that is just the bare minimum. Your body, physiologically, your body requires much more than what you're giving. Okay, so that is increased requirements. Specifically during infancy, when the weaning starts, the exclusive breastfeeding time is done, and when the child is put on weaning, okay, the child's body has high requirement of iron because the iron stores in the liver of the child is getting depleted. Okay, and that time you're not giving iron rich food to the infant, it will put them into anemic stage. During adolescence, specifically for girl children, teenage girls, and during pregnancy and lactation are the other two phases of life. Then inadequate absorption of iron because of diarrhea, okay, or any renal diseases, too much of antacid which is given, too much of if you are suffering from acidity and you take a lot of antacid, what happens is that iron requires an acidic environment for absorption. Okay, you need an acidic environment for absorption of iron. And what happens when you have antacid? Okay, your acidity reduces in the stomach, and that is not a good environment for iron to get absorbed in the intestine. Okay, blunting of the villi, which is common in celiac disease, and also in advanced iron deficiency, in severe stages of iron deficiency, the intestinal villi, which are supposed to absorb the nutrients, they become shorter and shorter. Okay, they are supposed to be elongated. Okay, they are supposed to be long finger like projections. Okay, but when you reach a severe stage of anemia, these long finger like projections villi in your intestine, they get shorter and shorter, and when they get shorter and shorter, it is difficult for them to absorb any nutrients, not just iron. Any micronutrients, macronutrient absorption will be impacted because of shortening of the intestinal villi. So all the causes, is it clear to all? Major causes. Coming to the diagnosis, how do you diagnose a person as anemic? Okay, the usual is hemoglobin test, but hemoglobin is the last part of your blood cell that shows that you're anemic. But before checking hemoglobin, there are specific other tests that you have to do so that you can catch anemia at the earliest as possible. Okay, so those who have the old textbook, page 213, table 11.2, diagnosis of iron deficiency. The name of the table is diagnosis of iron deficiency. Those who have the new textbook, you can put the table number or page number in the chat box. Diagnosis of iron deficiency is the name of the table. Table 13.2, page 261. So plasma ferritin level, transferrin level, hemoglobin level, or hematocrit levels. Okay, they are the ones which you have to do to indicate, which indicates iron stores. Okay, so plasma ferritin level, if it is dropping, it is initial stage of anemia. Just with dietary changes, you can correct it. Even transferrin level, okay, that is also dropping. With dietary changes, you can correct it. But when the hemoglobin level is also down, that's when iron supplements may be required for you. Okay, peripheral smear test can be done to check the peripheral smear is you take a blood drop, okay, on a glass slide. They will smear it, put a small another glass slide, and they will see the blood cells under microscope just to see the health of your RBC. Okay, is it microcytic, macrocytic, hypochromic, normochromic? Okay, to check all that, peripheral smear is done. Okay, serum iron levels is also checked. MCHG, that is another hemoglobin test, is checked. Okay, transferrin saturation, you can catch anemia earlier. Serum ferritin level, again, you can catch anemia at the initial stages. Just by dietary changes, you can correct it. When the ferritin level is going low or transferrin level is going low, just by dietary changes, you can solve the issue of anemia. But when hemoglobin level goes down, iron supplements will be required. Okay. So here you can see iron supplements are along with other multivitamins also, iron supplement is available. Okay. And what gram of iron supplements should be prescribed is also mentioned in the textbook. We will come to that later. At what age, to whom, what you're prescribing is available in the textbook. Just not that you are supposed to prescribe, but you have to be aware of it. Okay. Pharmaceutical iron supplements only doctors can prescribe. Dietitian can prescribe iron supplements which can be sold over the counter under nutraceuticals. Okay, nutraceutical prescription dietitian can do. Pharmaceutical prescription, like specific composition of ferrous sulfate, new generation iron supplements, okay, in specific composition, that can be prescribed only by doctors. Okay. So yeah, in non-pregnant women, as soon as the iron's hemoglobin is less than 12 gram per deciliter, consider them anemic. For men, if it is less than 13 gram per deciliter, anemic. Pregnant women, less than 11 gram, anemic. Okay. This is the WHO cutoff for the diagnosis of anemia given by World Health Organization. So coming to the stages of iron deficiency, this is the one I have said earlier. As soon as in the stage 1, decrease in iron stores from your liver, from your muscles, okay, from your bone marrow, when the iron stores are getting depleted slowly, step by step. One second. So that's when the ferritin levels from your serum ferritin levels are going low. Okay. So with diet, you can correct this. With diet, you can increase your serum ferritin level. Okay. Focus more on iron-rich food. For a month, you will see an increase in the ferritin levels. Stage 2. Okay. Your transferrin saturation goes low. What is transferrin? Transferrin is kind of a protein that is available in your blood, which helps transferring the iron molecules from point A to point B. Okay. Iron molecules in its ionized form as it is cannot travel in blood. Okay. They require a protein which attaches to this iron molecules, and because of which it can travel through the blood. Okay. So when this transferrin saturation in the blood is going down, it means you have reached the second stage of anemia. Okay. Again, with dietary changes and some nutraceuticals, you can correct it. And third stage is the final stage we call as iron deficiency anemia. And this is where finally your hemoglobin is getting affected. Okay. Because first the iron stores in the bone marrow has to go down, and then it will not produce good quality of RBCs, and that is seen in the reduction in hemoglobin levels in blood. Okay. So is it clear the stages of iron deficiency anemia? So clinical findings. How do you understand a person has anemia or not? Okay. Clinically, what are the signs and symptoms? First is immunocompetence. See, only through doing the blood test, signs and symptoms will never give you the right diagnosis. You have to do the blood test. You have to do these specific blood test, ferritin level, serum transferrin level, okay, hemoglobin level. This you have to do. You have to go to the laboratory, get the blood test done. Only then you can diagnose. Just by looking at the signs and symptoms, you can't say if it is just stage 1, stage 2, or stage 3. Okay. So when a person reaches the stage of iron deficiency anemia, that is stage 3, what are the common clinical findings that you see? Symptoms. Okay. First is immunocompetence. Your T cells, which guards you, which is kind of a natural defense system you have within your body, your immunity, it goes down. Immediately you will get infected with many infections. Okay, easily you will fall sick. Then diminished work performance, not able to concentrate in your work, not able to focus in work. Okay, feeling very, very tired. Okay, no enthusiasm to go to work or to work. Okay, so that is your work performance will diminish. Even exercise. Okay, earlier you were able to do 2 hours of walking or running. Now you can't hardly do 1 hour of walking. Okay, then your cognitive development, it is seen in young children, young adults, young teenagers. uh, their academic performance falls. Earlier, they were scoring good marks, but slowly you see they have low energy. They're not performing as well as how they used to. Okay, and their motor function, their language development, concentration level, behaviors. They will get very irritated. Small, you will shout them for a small thing or little thing. They will get irritated, agitated, anger issues. Okay, so that is seen in as a cognitive development issue because of iron deficiency. And they are more disruptive. Okay, more irritable, more restless in classroom. A lot of temper tantrums these children will have. Breath holding spells. You must have seen some children who cry. They are not able to breathe while they're crying. Okay, they take a big cry and they're not able to breathe properly, and their eyes will roll up, roll inside their eye socket, and they may faint sometimes. Okay, because they are not able to breathe in between their cries. That is breath holding spells. Okay, so that is also seen. And ice eating, that is phagophagia. Okay, they have this tendency to eat a lot of ice chips. They want to just bite on ice. So that is, if a child is having this specific tantrum, they want to eat ice. Okay, that is another behavioral implication. And once you start administering iron supplements, iron syrup is also available for pediatrics. For pediatric cases, iron syrup is available. Okay, so once you start giving them supplements, these symptoms will reduce. Okay, they will become more calmer, and they will concentrate more. Breath holding spells will go away. Then structure and function of your epithelial system, usually your tongue, your nails, your skin. Okay, the mucous membrane in your mouth, your stomach. Okay, gut lining. Okay, these things are affected because of iron deficiency. Skin will appear very pale, dry, and specifically your lower eyelid. You must have seen the doctors will check that. Okay, what is the redness, what the amount of redness in your lower eyelid. Okay, that can, it should be slightly, it should be pink, it should be reddish in color, but it turns pale pink or pale in color. Fingernails will become very thin, flat, and eventually you will have koilonychia. Koilonychia means spoon shaped fingernails. Okay, spoon, usually your fingernails are concave. It looks, appears concave, it should go downward. Okay, but those who have iron deficiency, their fingernails will grow upward, so it will have a convex kind of a shape. That is koilonychia. So treatment: iron supplements in form of ferrous sulfate. Okay, so ferrous sulfate or supplements, 50 mg to 200 mg. Okay, that is the range. It is given. For adults, there you have different dose. For children, it is 6 mg per kg for children. Whatever is the child's weight, depending on the child's weight, 6 mg of ferrous sulfate per kg. Okay, if the child is 20 kg, the weight of the child is 20 kg, 120 mg should be the dosage, like that. Okay, three times daily for adults, 60 mg is given, and one time for a child, 6 mg per kg, whatever is the dosage, and how you can divide it through the day. But that particular dosage has to be given to children. There are different forms of iron in forms of sulfate, lactate, fumarate, okay, glutamate, gluconate. These combinations, only a physician, a doctor can decide which combination can work better for you. And iron is best absorbed, iron tablets are best absorbed when your stomach is empty, but it should be acidic in nature. Your stomach should be acidic in nature. Have iron supplement or iron tablet with orange juice, lemon juice. Okay, it's good. The presence of vitamin C, or with even with amla juice. Okay, if you have a habit of having citrus fruit juices, have your iron supplements with these fruit juices. It's ideal. Okay, vitamin C enhances the absorption of iron. Don't have iron supplements with milk or buttermilk or any curd, any dairy products which is rich in calcium. Okay, at least give 2 hours of gap. If you're taking calcium supplements and iron supplements, best to take iron supplements first in empty stomach with a fruit juice. Okay, vitamin C rich fruit juice. It will not give you acidity. Okay, citrus fruit juice in empty stomach will not give you acidity. So have that first. After 2 hours, you can have your calcium supplements. Okay, or you can keep your iron rich food, calcium rich food in completely separate meals. But sometimes you may have some side effects because of iron supplements. Usually it is nausea, vomiting. So it's a trial and error. If on empty stomach, when you are having iron supplements, if you don't face any nausea, vomiting, or any acidity issues, you can continue having iron supplements on empty stomach. But if it is irritating your gut, if it is giving you nausea, vomiting, it happens usually in pregnancy. If you have iron supplements on empty stomach, you may face some degree of nausea and vomiting. Okay, so it's better to have them just 10 to 20 minutes after you have your food. And iron therapy should be continued even after your hemoglobin levels come back to normal. It has to be continued for several months. Just because your hemoglobin levels or ferritin levels are back to normal, immediately don't stop using the supplements. Nowadays, the iron supplements, that is the new generation combinations that you have, okay, of iron supplements, they are not causing constipation. 5 years back, 10 years back, the iron supplements that was distributed, even from the PHCs, those were notorious for this constipation kind of situation as a side effect. But the new combination ones are not giving any constipation or similar side effects. Okay, it's the new generation iron supplements are much better. And along with that, vitamin B12, folic acid supplements should also be given, because folic acid and B12, just like vitamin C, folic acid and B12 will also enhance the absorption of iron. And folic acid and B12 is also required for your hemoglobin production, RBC production. From diet, if you are referring diet for the treatment, in the initial stages, stage 1 and stage 2, best source of diet is the heme source of iron that comes from non-vegetarian food, meat, poultry, organ meat, seafood. Okay, and non-heme sources of diet is dark green leafy vegetables, dry fruits, nuts, seeds, millets like ragi. Okay, coming to folate deficiency causes, your intake is less, your age. Okay, senior citizens definitely they develop folic acid deficiency because not absorbing properly intestines. Alcohol issues will also cause folic acid deficiency, and absorption issues which you already have, like any specific disease like celiac disease, gastroenteritis, gas issues, And if you have removed a part of your intestine, small intestine, okay, jejunectomy, okay, that is a removal of jejunum, okay, so that could lead to absorption issues and increase in the demand, but you're not meeting the demand because of pregnancy, infancy, adolescence, hemolysis. Too much of hemoglobin is getting broken down because certain medications, certain drugs can do this. Okay, certain drugs and some bacterial infection, some viral infection, bacterial infection can also do hemolysis. They can break down your hemoglobin. Okay, and tumor, malignancy, cancer, dermatitis. Okay, the why dermatitis? From your skin also you lose iron. It's not just because of bleeding. Okay, everyone loses some few grams of iron from their skin when you have dry skin. The skin flakes that flakes off. Okay, specifically when you see in winter months. Okay, everyone suffers from dry skin, flaky dry skin. Okay, so when you see the skin is becoming white and it is flaking off, you can peel the skin off, you are losing iron as well. Okay, so dermatitis, people who suffer from dermatitis, they lose iron, and their requirement of iron is also high. Anyone who is on these drugs, methotrexate, sulfasalazine, okay, uh, trimethoprim, phenytoin, and any OCPs, okay, contraceptive, oral contraceptive pills, okay, or OCP is oral contraceptive pills, birth control pills. So if anyone is on these drugs, they also suffer from folate deficiency because it will interact with the intestinal absorption. It will interfere with the intestinal absorption of folate. So clinical features of folic acid deficiency, folate B12 deficiency: sensations of weakness, numbing and tingling sensation in the fingers, end of the fingers and toes. Okay, paresthesia kind of. Okay, you are touching yourself in the fingertips or toe tips, but you don't feel it, and you feel a tingling sensation there. Ulcers in mouth, sore tongue, feeling of weakness. Okay, not able to concentrate. These are the clinical features of folate deficiency. So treatment, 5 to 10 mg daily dose of folate is prescribed. Blood transfusion only in severe cases, and specifically those who have hemoglobin which is less than 5 gram per deciliter. Okay, when it is this severe iron deficiency, blood transfusion will be required. Okay, pulses, green leafy vegetables, fish, liver, eggs, have this, add this in diet. It can enhance your health. The next form of anemia is hemolytic anemia. From the name itself, you can understand hemolytic, breakdown of hemoglobin, okay, of RBC. So here RBC is getting broken down. It's kind of an autoimmune disease, which means your own immunity is attacking your own RBC. Your own immunity is breaking down your own RBC and hemoglobin. Okay, so definitely you will lose a lot of RBC, and when the RBC rate comes down than normal, you are anemic. Okay, so since it is an autoimmune disease, the cause is idiopathic. Idiopathic means we are not sure about the cause yet. Okay, autoimmune diseases are also hereditary, so it could be given by your family, but apart from that, it's idiopathic means we are not sure about the exact cause. Sometimes it can be related to some medication side effect or any other underlying disease conditions. Prevention with diet, focus on iron-rich, folic acid-rich diet, supplementation, iron supplement, folic acid, and education. Uh, so in diet, balanced diet, which is rich in protein, vitamins, minerals, should be consumed. And stage 1 anemia and stage 2 anemia is preventable just by diet. But when it is stage 3 iron deficiency anemia, you have to seek help. You will require the aid of nutritional supplements or pharmaceutical supplements as given by your physician. And even after the hemoglobin levels are normal, you have to keep consuming the iron tablets for months together. Then supplementation, we have a lot of PHCs, CHCs, they provide free ferrous sulfate, free folic acid tablets under the National Nutritional Anemia Prophylaxis Program. This is a national nutritional program launched to control and to reduce the number of anemia cases in India. Okay. And as a part of the mother and child health program, okay, mother and child health services, under five services as well. Pregnant women, lactating women, okay, they are, and preschool children, they get folic acid and ferrous sulfate. Expectant mothers, lactating mothers are also given 60 mg of iron and 0.5 mg of folic acid, free of cost. It's distributed. And children, under 5 children, okay, under 5 services are also a part of the nutritional programs. So children under 5 are given 20 mg of iron and 0.1 mg of folic acid. And when you regularly consume green leafy vegetables, consume cereals like wheat, ragi, jowar, bajra, okay, add more jaggery into your diet. Only if you're not diabetic. Diabetics should, those who are diabetic, avoid jaggery. It will also increase your blood glucose level the same way how sugar does it, okay. Foods of animal origin, specifically organ meat like liver, can prevent anemia. Fruits rich in vitamin C helps in the absorption of folic acid and iron. Dietary sources rich in iron of per 100 gram is given on page number 222. Those who have the new textbook, you can put the page number in the chat box. You can refer the table later. Every 100 gram of the food source given in that table, how much gram of iron you will receive, okay. Education, all the medical healthcare workers and social workers, horticulture department, okay, they have this role to play to promote the consumption of iron rich food in their area, okay. Create awareness in, specifically in pregnant women, lactating women, preconceptional women, okay. Before getting pregnant, make sure the woman corrects her anemia and vitamin B complex deficiencies should be corrected before even a woman gets pregnant. This awareness has to be created. Importance of adding iron rich food in weaning diet. And soon after having any iron rich food, don't consume tea, because tea has tannins that will again affect iron absorption. Keep calcium consumption and iron consumption, that's a separate, a good hourly gap should be there between iron and calcium consumption. It's on page number 270 in new textbook. Then we have fortification. Salt fortification is done right now. Double fortified salt. And salt nowadays is not just fortified by iron, but with iodine, folic acid, B12, vitamin A, zinc, okay. Salt is getting fortified with a lot of ingredients. Fortified wheat is available. Fortified bread is also under development. And successfully fortification of iron in sugar, rice, milk, curry powders, okay. This fortification is successful. So that is also a way how we can prevent iron deficiency anemia in a national wide sector. So that's about nutritional anemia.